Welcome to an introduction to Enable New South Wales. This presentation is the first in a series of modules designed to complement and support our education sessions. Module 1 provides a general overview of Enable New South Wales and may be completed by prescribing clinicians or others interested in learning about our service. Prescribing clinicians may wish to complete further modules relevant to the program area they work in. These are also available on the Enable New South Wales website. The objective of this module is to provide an overview of Enable New South Wales, including the programs and support services available, eligibility criteria, co-payments, and Enable New South Wales and the NDIS. The information covered in this presentation is particularly relevant for clinicians who may include occupational therapists, physiotherapists, speech pathologists, dietitians, nurses, orthotists and prosthetists, podorthists, and medical specialists. Enable New South Wales is a division of HealthShare New South Wales, which is part of New South Wales Health. We provide assistive technology for long-term loan, individually made items, and specific and prescribed consumables, such as home enteral nutrition and continence products to support health needs. Assistive technology assists a person's function, independence, and/or safety. They help people perform activities they may not have previously been able to do and may also prevent impairment or development of secondary conditions. We also provide financial assistance for people who need to travel significant distances to access specialist medical treatment, which is not available locally. In any given year, we may help 20,000 people with assistive technology to support their health needs, receive 69,000 calls and 64,000 emails, coordinate 3,500 equipment repairs and maintenance requests, process 68,000 applications for travel and accommodation. Our programs and support services include AIDS and Equipment Program, including Equipment Allocation Program and Specialised Equipment Essential for Discharge, Prosthetic Limb Service, Home Respiratory Program, Home Ventilation Program, Isolated Patients Travel and Accommodation Scheme, Away from Home Hemodialysis Program, Hunter Prosthetics and Orthotics Service, and Albury Prosthetics and Orthotics Service, and Safe and Supported at Home Home Modifications Program, which has allocated funding until June 2022. Enable New South Wales also coordinates repairs and maintenance requests for equipment provided through our programs. To be eligible for assistance from Enable New South Wales, a person must be a resident of New South Wales or Lord Howe Island, or an asylum seeker, refugee or humanitarian visa holder residing in New South Wales or Lord Howe Island, be enrolled with Medicare, the assistive technology is prescribed to support a health need, and they are not receiving or eligible for assistive technology through a third-party insurance or other Commonwealth, state or territory government schemes for the identified health need. Possible alternative funding sources are National Disability Insurance Scheme, Department of Veterans Affairs, Australian Government Aged Care Services, compensation or damages for the condition requiring assistive technology, for example, workers' compensation, not to be an inpatient at a private hospital. A person's eligibility is assessed each time a request for assistive technology is received, as eligibility may be limited to specific programs or assistive technology types. An eligibility indicator is available on the Enable New South Wales website, and we also encourage people to speak to an Enable New South Wales customer service officer to discuss their individual circumstances. Enable New South Wales requires a co-payment from people who access assistance from the AIDS and Equipment Program, Equipment Allocation Program, Home Respiratory Program, and Prosthetic Limb Service. The co-payment is means tested for adults, and the person will be advised of the co-payment amount at the time of equipment approval. A co-payment is charged every financial year a person accesses Enable New South Wales, including for new items of equipment, repairs and maintenance, and ordering of consumable products such as continence or home enteral nutrition products. Further information about co-payments is available on the Enable New South Wales website in the For Individual section. We'll now take a look at each of our programs and support services in a little more detail. The Aids and Equipment Program provides assistive technology, primarily loaned, that supports health needs. The assistive technology assists a person's function, safety and/or independence, and is for the long term or individually made items as determined by the prescriber, as well as specific and prescribed consumables. Equipment or consumables are provided to assist with mobility, self-care, and communication. Examples include wheelchairs, hoists, walking frames, footwear and orthoses, compression garments, bathing and toileting aids, continence products, and low vision aids. For additional information about the Aids and Equipment Program, please refer to the Enable New South Wales website and Enable 101 Education Module 2. The Equipment Allocation Program provides a range of standard stock assistive technology that may be new or in like-new condition. This program is managed by the Enable New South Wales Equipment Centre in Homebush and is available for people living in the following areas: Sydney Metro, Illawarra Shoalhaven, Nepean Blue Mountains, Central Coast and Murrumbidgee. Some local government areas within the Lower Hunter, including Lake Macquarie, Newcastle, Maitland and Cessnock, are also included in the stock delivery area. Prescribers for people living within these areas must always consider stock items in the first instance. There are some items from stock that can be provided anywhere in New South Wales. These include pressure cushions, slings, manual wheelchairs and scooters for community access, power wheelchairs, and paediatric equipment. The Equipment Allocation Program provides a faster process for people who would otherwise get quotes and progress to a waitlist. For additional information about the Equipment Allocation Program, please refer to the Enable New South Wales website and Enable 101 Education Module 3. The SEED program provides specialised equipment essential for discharge to eligible people with a new spinal cord injury or an acquired brain injury. The person's condition must be considered permanent. To be considered eligible for SEED, the person must be an inpatient of a specific New South Wales Health and affiliated inpatient rehabilitation facility, specialist outreach service, or comparable interstate specialist service, where the planned discharge destination is a community setting in New South Wales. To apply for SEED, Enable New South Wales must receive a consumer application form completed by the person or their representative and a SEED application form completed by the clinical service. Enable New South Wales will advise the outcome of the SEED application to the person and to the clinical service. Once eligibility is confirmed, the prescribing clinician can request equipment essential for discharge through stock or contract using the appropriate request form. Requests for equipment through the program must meet the relevant funding criteria. For additional information about SEED, please refer to the Enable New South Wales website. The Prosthetic Limb Service provides prosthetic limbs and consumables for eligible people across New South Wales. This includes those who have had a major amputation or people born with congenital limb deficiency. People requiring prosthetic limbs will consult with a clinical team consisting of a rehabilitation physician, physiotherapist, and prosthetist to determine the most appropriate limb for individual circumstances within the guidelines of the scheme. These teams work in amputee clinics located across New South Wales. A list of accredited amputee clinics is available on the Enable New South Wales website. Prosthetic limb services are provided on behalf of Enable New South Wales by 7 commercial and 2 public prosthetic service providers who are each contracted to various amputee clinics in each local health district. These service providers are accredited by Enable New South Wales to ensure a high standard of quality service provision. They interface with the amputee clinics, although not all service providers can attend all clinics. A person living in a residential aged care facility or a person with a DVA Gold Card may also apply to this program for a prosthetic limb. For additional information about the prosthetic limb service, please refer to the Enable New South Wales website. The Home Respiratory Program provides home oxygen equipment, CPAP machines, bi-level ventilation machines, ventilators for life support or invasive ventilation, suction equipment, mechanical inexsufflation and humidification to eligible people to manage their respiratory condition and maximise their independence in their own home. We also provide respiratory consumables for tracheostomy, suction, continuous or invasive ventilation, and equipment for people who have had a laryngectomy, including voice prosthesis. For additional information about the Home Respiratory Program, please refer to the Enable New South Wales website. The Home Ventilation Program provides funding assistance to eligible adults and children who are dependent on mechanical ventilation, require significant care needs to be discharged from hospital, and can be safely cared for in their home. Funding is provided for some hours of attendant care services to assist families to care for their family member at home. Enable New South Wales, together with a member of the specialist team and the local health district care coordinator, appoints a care provider using a New South Wales government contract. Enable New South Wales only contracts care providers who are accredited to provide care for a person with complex care needs, including management of ventilators or tracheostomies. The local health district where the person resides is required to nominate an LHD care coordinator to assist with any concerns once the person is settled at home and to be the liaison person between Enable New South Wales, the person's clinical service, the attendant care provider, and the local health district where they reside. Respiratory equipment and consumables are also funded as per the Home Respiratory Program criteria. This also includes repairs and maintenance of the equipment. Please be aware, for people eligible for NDIS, new attendant care packages are to be commenced through the NDIS, and current Home Ventilation Program attendant care recipients are in the process of a transition to the NDIS. Enable New South Wales will continue to provide and maintain respiratory equipment and consumables. The Enable New South Wales Home Ventilation Program will remain available for people not eligible for other funding programs. For additional information about the Home Ventilation Program, please refer to the Enable New South Wales website. IPTAS is the Isolated Patients Travel and Accommodation Assistance Scheme. This is a New South Wales Government scheme providing financial assistance towards travel and accommodation costs when a patient needs to travel long distances for treatment that is not available locally. To access financial assistance through IPTAS, a person must be a resident of New South Wales or Lord Howe Island, be enrolled with Medicare, not be receiving or eligible for financial assistance for travel and accommodation from third-party insurance or other Australian government services, be referred for treatment at the nearest health service, receive treatment at an approved health service, travel from their residence for treatment at least 100 kilometres one way, or at least 200 kilometres in a week by making multiple trips to and from treatment. For additional information, please refer to the IPTAS website or contact the service directly on 1800 478 227. The Away From Home Haemodialysis Program is a service offered to people who live in New South Wales and who require haemodialysis treatment away from their home. This program allows a person the flexibility to travel for education, work, or short holidays while still receiving their treatment. This program is administered by Enable New South Wales on behalf of the Ministry of Health. Eligible people may access up to 3 sessions per year at a participating private dialysis unit. The 3 sessions can be at the same unit or at a different participating unit. If they need more than 3 sessions, they must call or email Enable New South Wales to discuss their individual situation. To be eligible, a person must be a New South Wales resident undergoing regular haemodialysis at home or in a centre-based dialysis unit for at least 3 months, be well enough to travel, meet the receiving dialysis unit's clinical criteria, have functioning, non-infected vascular access. Enable New South Wales has partnered with the New South Wales Ministry of Health to implement a home modification program as part of its Safe and Supported at Home (SASH) Home Modification Initiative. The program accepts referrals from occupational therapists for home modifications to assist eligible people to remain living at home safely, or where discharge from hospital or potential readmission is impacted by an inability to access funding for home modifications. Eligibility criteria are available on the Enable New South Wales website or can be discussed with a clinical advisor for the program. The key criteria are agreement from the homeowner to complete temporary or permanent home modifications, aged 64 years and under, not eligible for any other government funding scheme, have a functional impairment that impacts their ability to manage activities of daily living, and/or require home modifications to live at home safely. Please be aware the eligibility criteria for the Enable New South Wales SASH Home Modification Program will be reviewed periodically and may change dependent upon demand and available budget. The program currently has allocated funding until June 2022. Any further updates will be provided on the Enable New South Wales website. When cost-effective, Enable New South Wales provides servicing, maintenance and repairs due to expected wear and tear. Repairs as a result of accidental damage or caused by unintended or unexpected events are considered on a case-by-case basis. The person using Enable New South Wales services, their family or carers are responsible for the day-to-day cleaning, checking and maintenance of the equipment, such as maintaining cushion or tyre pressure. The equipment's user manual outlines instructions for use for these tasks. Repairs may be requested by the person who has the equipment or their representative. Most repairs are arranged directly with Enable New South Wales either by telephone or email. However, repairs of the following items should be arranged directly with the supplier. Prosthetic limbs, minor repairs only. Major repairs require a prescription written at an amputee clinic. Oxygen concentrators and cylinders, and feeding pumps. For emergency situations outside our office hours, the person can contact one of the authorised repairers listed on the Enable New South Wales website. The person must also contact Enable New South Wales the next business day by phone or email to advise us of the repair. People are responsible for replacement and repairs for any assistive technology or accessories that they self-fund. Reimbursements for self-funded repairs are not provided. Albury Prosthetics and Orthotic Service, APOS, provides a complete range of prosthetic and orthotic solutions in the Greater Albury, New South Wales, Victoria region. This comprehensive service includes a range of support provided in conjunction with the Murrumbidgee Local Health District and Albury-Wodonga Health. For further information, please contact APOS directly. Hunter Prosthetics and Orthotic Service, HPOS, provides a complete range of prosthetic and orthotic solutions in the Hunter New England region of New South Wales, Port Macquarie and Dubbo. The team have strong working relationships with John Hunter Hospital and Rankin Park Services, providing both acute and complex services to inpatients and outpatients. The team also has established relationships with referring doctors and allied health professionals, both public and private, across the health sector. For further information, please contact HPOS directly. It is expected people under 65 check their eligibility for the National Disability Insurance Scheme and make an access request through the NDIS to ensure they receive the appropriate funding for their disability supports. For people under 65 who have a permanent and significant disability and do not meet the eligibility requirement for the NDIS, we will require written correspondence from the NDIA that tells us why they have been declined. This includes decisions by the NDIA to decline requests because of a health condition. Enable New South Wales will continue to provide assistance for people 65 years of age and over, and those not eligible for the NDIS, either due to their age or health condition, who meet the eligibility criteria for our programs. Many of our services, including the funding of respiratory consumables and equipment, such as oxygen concentrators, will continue to be available to people of all ages. Enable New South Wales will also continue to fund a person's first prosthetic limb after major amputation surgery. While we will continue to support existing Enable New South Wales clients who have not yet transitioned by providing the right information, we strongly encourage those who are eligible to transition to the NDIS as soon as they can. We continue to be an NDIS registered provider, offering specialist clinical services through our Albury and Hunter prosthetic and orthotic services. We may also order consumables such as continence products for NDIS participants who are agency managed. Please be aware this will be reviewed periodically and may change dependent upon demand. Any further updates will be provided on the Enable New South Wales website. Further information about the NDIS and eligibility for the scheme is available from the NDIS website, www.ndis.gov.au. If you require assistance, please contact the relevant service team who will assist you with your query. Also regularly check the Enable New South Wales website for up-to-date information. Other education modules are available on the website and include Module 2, Aids and Equipment Program, Module 3, Equipment Allocation Program, and Module 4, Home Respiratory Program. We recommend you complete the modules relevant to your area of interest.